Hi, hello everyone. Welcome to Agni Nursing Academy. I am Prakash Murki. This is the second session of our MCQ class. Then coming to the first question, that is tracheostomy most commonly performed at what level given below. Here they have given four options. Then coming to the first option, first and second tracheal ring, and second and third tracheal ring, third and fourth tracheal ring, and fourth and fifth tracheal ring. Okay, what is this tracheostomy? And this is the tracheostomy when we have to do when the patient fail to respiration, that is whether the patient is not able to respirate, like respiratory failure and upper airway obstruction, upper airway obstruction in upper airway obstruction like CA or larynx, in laryngeal cancer, and foreign body obstruction, foreign body obstruction. In this condition, we will do the tracheostomy. We have to open the trachea and insert the tube into the trachea to maintain the patient's respiration by artificial. Okay. Then most commonly we will performed at the level of second and third tracheal ring. This is the right answer of this question. Okay. There are some types of tracheostomy levels are there. Here high tracheostomy, mid tracheostomy, low tracheostomy. Then coming to the high tracheostomy. What is this high tracheostomy? High tracheostomy means we will insert the uh, tracheostomy tube into the trachea between the first and second ring of trachea, between first and second ring of the trachea, and that is above the level of isthmus of thyroid gland, above the level of isthmus of thyroid gland. Okay, in which condition we will use this high tracheostomy means CA of larynx, CA of larynx, cancer of the larynx. So we will use this high tracheostomy level. Okay, clear? Next one, mid tracheostomy. Mid tracheostomy, that is the most commonly used level. Okay, that one we will insert the tracheostomy tube at the level of isthmus at the level of isthmus of thyroid gland. And the what about rings? Between the second and third ring, between the second and third ring we will insert the mid tracheostomy level. This is the most commonly used tracheostomy. There is no contraindication, less contraindicated in this site. That's why it most commonly used site. Then coming to the low tracheostomy. What is this low tracheostomy? In this tracheostomy we will insert the tracheostomy tube below the normal level or below the isthmus of thyroid gland, isthmus of thyroid gland. And what about rings? Rings below the fourth ring, below the fourth or between third and fourth ring, below the third and fourth ring and below the fourth ring. There is a contraindication in the low tracheostomy. It has a contraindication, that is pneumothorax. While insertion, if we can damage the pleural cavity of lung. So there is a contraindication, that is pneumothorax. Okay, coming to the question, and answer of this question is B. Second and third is the most common used site, most common used site. Okay, clear? Move on to the next question, that is which of the following best defines a massive blood transfusion? This question so many times they will ask on the blood transfusion reactions and massive blood transfusion, Every time, every exam, they will ask on the blood transfusion. Now they have asked massive blood transfusion. What is this massive blood transfusion? Here, massive blood transfusion, when it can happen? It can happen if we transfuse the 10 PRBC. 10 PRBC are more than 10. Okay, more than 10 PRBC if we transfuse means it is in this condition we called as a massive blood transfusion. Okay, then coming to the options, a transfusion of 4 units packed RBC in 1 hour. Normally we will infuse the 1 PRBC within the 4 hours. So one PRBC we will infuse within 4 hours. So this is not the answer. So this is the wrong answer. Option A is wrong. Then transfusion of 5 units of PRBC in 6 hours. So this is also the wrong answer. And coming to the C, transfusion of 10 or more units of PRBC within the 24 hours. Okay, this is the correct answer of this question. And option D is transfusion of any amount of blood along with the blood with 12 hours. This is wrong answer. Okay, correct answer of this question is C, transfusion of 10 or more units of PRBC within the 24 hours. Okay, then how we can prevent this massive blood transfusion? There is a formula to prevent the massive blood transfusion prevention. That is, there is a formula that is 1:1:1. What is this 1:1:1? 1 means 1 unit of PRBC. 1 unit of PRBC. After 1 PRBC, we have to infuse 1 unit of platelets. And third one, 1 unit of FFP, plasma, fresh frozen plasma. By using this formula, if we infuse like this means we can maintain the homeostasis in the blood and we can prevent the massive blood transfusion. Then correct answer of this question is C, transfusion of 10 or more than 10 PRBCs. Okay, then move on to the next question, that is, what is the most common type of reactions associated with the transfusion of cellular blood component? That is again on the blood transfusion. Cellular, don't confuse with the cellular means it may be the PRBC, platelets or FFP. Okay, if a patient you are infusing the PRBC, then most commonly the patient can get a which reaction? The most commonly occurring reaction is this one, option B, febrile non-hemolytic transfusion reaction. Option B is the correct answer, because this reaction happened within 15 minutes of transfusion. 15 minutes of transfusion. So if you start the blood transfusion, we have to observe the patient and be with the patient up to 15 minutes. Observe the patient for 15 minutes. First 15 minutes this reaction can happen, so we have to observe the patient for first 15 minutes. And coming to the option A, anaphylactic reaction. When it can happen? Anaphylactic reaction. If the receiver having anti-IgA and donor having IgA. If patient having anti-IgA and donor having IgA, these two are make antigen and antibody reaction and cause the reaction. That is anaphylactic reaction by the reaction of anti-IgA and IgA. Then coming to the option C, acute hemolytic transfusion reaction. Option C, when it can happen? It can happen in the mistake in the RH compatibility test. There is a lab technician mistake. Okay, RH incompatibility. This reaction can happen. how we have to identify this hemolytic transfusion reaction means we have to observe the we will see the Planck pain, okay, Planck pain, and hematuria we can observe blood in urine. Hemolysis can happen and that can cause a hematuria, and Planck region pain can, we will see in the acute hemolytic transfusion reaction. Okay, answer of this question is B, febrile non-hemolytic transfusion reaction. Okay, move on to the next question. That is, a patient's MEWS score is calculated as 7. What does this indicate in terms of patient severity and clinical response? See, in this question only they are asking MEWS score. MEWS score. What is this MEWS score? For what purpose we have to use this score? Let us discuss. Okay, MEWS score. What is this MEWS mean? MEWS score means modified early warning sign score. What is this modified early warning sign score? This score can we have assess the severity of the patient. Severity of the patient we can assess. Okay. Then what all are the components will come in this MEWS score means first one, heart rate and respiratory rate, temperature and BP, that is especially systolic BP we have to observe, and last one, level of consciousness. These are all 5 components will come in the MEWS score. These 4 are like a vital signs. Okay, and one more is level of consciousness. Then this MEWS score given by American. Okay, here the table is there. We have, and in this how we have to give the scoring for the abnormalities in the patient. Okay, here they are given respiratory rate. Here if the patient respiratory rate 9 to 14 means we have to give 0, and more than 15 more than 15 or 15 to 20 we have to give 1, and above the 20 to 21 to 29 we have to give 2, and above 30 we have to 3. Like this abnormal vital signs we have to give the scoring system. If a patient respiratory rate below the normal condition also we have to give scoring like less. If a patient respiratory rate is below the 9 means we have to give 2 score. So again they have given heart rate and systolic blood pressure and temperature and level of consciousness, that is alert and spontaneously patient responding means we have to give 0, and on voice he is responding means we have to give 1, on pain we have to give 2, and on response means we have to give 3. And here one point is given, that is contact the physician when MEWS score is more than 4. Here more than 4 means we have to inform the physician. And one more thing, oxygen saturation drops below the 90. See here they have given below the 90 means we have to start the oxygen without doctor's orders. We can start 2 liters per minute, we can give the oxygen, and we have to inform to the doctors. Okay, again in the they have given color coding for the severity of the patient. In the options they have given stable, mild, significant and critical. So they have given color code, and they in option they have given these types: stable, mild, significant and critical. If the patient is stable, MEWS score will be the 0, and follow up and new measurement after 24 hours. Okay, after 24 hours we have to observe the patient. And in yellow, mild score is 1. Like that they have given. If the patient condition is critical means MEWS score will be the more than 4, and contact the physician. Then coming to the options, option A is saying stable routine monitoring. So here they have given 7, score is 7, more than 4. So answer of option A is wrong. It is not the stable, and here mild deterioration is there. So this is also the wrong. MEWS score is 7, not the 1. Here 0. Significant deterioration and critical condition. Here confusion is there because patient is in a severe condition. We have to start a immediate treatment. So if the patient is in the normal ward, we can't give the critical care unit critical care in the normal ward. So we have to give the urgent interventions. According to this question, the correct answer of this question is require urgent interventions. So answer of this question is C, significant deterioration of we need the urgent interventions. Okay, then move on to the next question, that is doctor instructed to transfuse the 1.1 unit of PRBC to the patient with a HB 7 gram. During the transfusion, nurse noticed that the patient having the mild allergic reaction. What should be done by the nurse on priority? So priority they are asking, and patient having the 7 7 7 gram HB and patient getting mild allergic reaction. If you are transfusing that blood transfusion, if anything happens means we have to stop the transfusion. Okay, if anything happens means we have to first priority is stop the transfusion. Okay, how to manage the blood transfusion reaction? Okay, management, how to manage the VT reaction. If patient getting transfusion of and on PRBC, now patient got a allergic reaction. First step you have to stop the transfusion. You have to stop the transfusion and you need to inform to the doctor. Second one, inform to doctors. Then after that we have to maintain the patency of the cannula, because we are going to give the medications immediately. If anything happens, we have to give the medication for the patient. So we have to maintain the patency of the cannula, patency of IV line, by giving the which fluid we can give to in the during the transfusion. That one 0.9% NS flush. By giving this flush we have to make patency of the IV line. Okay, after that we have to return the blood bag to blood bag return the blood bag to blood bank. And after that we have to discard IV set, not cannula, IV set only. Okay, after that we have to take the investigation blood sample collection. Okay, sample collection like blood for RH incompatibility or anti-IgA antibody. Okay, and urine also we have to test for hematuria. Hematuria can happen in the hemolytic reactions. Okay, download the Agni Nursing Academy app from the Play Store. If you want to test series and more information about the Agni Nursing Academy, what are the features, you can download it from the Play Store and subscribe our YouTube channel also. Okay, move on to the next question. That is, if the patient BP is 158/94 mm of Hg, then the condition is called. In this question, they asked types of hypertension or BP. There are 5 types and 4 types in the hypertension. That one, first one is stable hypertension. Okay, here BP is seen in this question. BP is in the not in the normal condition. It is higher than the normal. So there are types in the levels in the hypertension, that is stable BP and elevated and high blood pressure, high BP, that is stage 1, and again high BP stage 2, and one more hypertensive crisis. In let us discuss what all are the BP range in these types. Okay, coming to the table, there in this table given by the American Heart Association. Okay, what is the in the table means, in the normal condition that a systolic BP is lesser than 120. If the patient BP is lesser than 120 means it's a normal BP, and diastolic also 80. Then coming to the next one, elevated. If the patient BP is more than 120 to 129 means it's a elevated. 120 to 129 means it's elevated blood pressure, and diastolic is less than 80. So here both stable and normal and elevated, diastolic is normal only, but difference is systolic BP. Here more 120 to 129 in the elevated. Okay, then stage 1 there is BP is 130 to 139, and here changes in diastolic 80 to 89 considered as the stage 1 hypertension. And coming to the stage 2 hypertension, that is BP is more than 140 or higher, and diastolic is 90 or higher than 90. So this is the second stage. In coming to the hypertensive crisis, this is the last stage. We have to inform immediately to the doctors, that is systolic BP is 180, more than 180, and diastolic is higher than 120. Then coming to the options, that is hypertension grade 1, and this grade 1, in grade 1 they have given more than, in the stage 1 they have given 130 to 139. So this is also not answer. Then this is not the normal BP, this is the 150 by 158 by 94. Okay, here more than 140 is the grade 2. So, and coming to the severe hypertension, severe means hypertensive crisis. Okay, and this is hypertensive crisis. The correct answer of this question is, correct answer of this question is C. Correct answer of this question is C. Hypertension grade 2, that is more than 140. Okay, if a hypertensive crisis, BP will be the one more than 180. So answer of this question is C. And coming to the next question, SIMS position is given in which procedure? See, remember this SIMS position. Sorry, remember this SIMS position. Almost all exams are repeatedly asked position, especially it's asked in the NORCET-5. NORCET-5 they have asked this position. Okay, recovery position. Okay, then coming to the options, rectal examination, B pap smear sampling, and spinal surgery, and pleural tapping. If SIMS position means in this SIMS position we will give in the rectal for rectal examination. For rectal examination we will use a SIMS position. So correct answer of this question is A. Sorry, correct answer of this question is A. Sorry, option A is the correct answer. In anemia also, in anemia also we can give the SIMS position. Okay, obtaining the pap smear sample. See, for pap smear we have to give the lithotomic position. Lithotomic position, or vaginal examination we have to give lithotomic position. And coming to the option C, spinal surgery. If you are doing spinal surgery, spinal tapping, or lumbar puncturing, we have to give the C position, C shape position, or fetal position. Fetal position, you have to flex your knees up to the chest, and again flex the head, which is chin, it should be touches our knees. Okay, this is for spinal tapping. Okay, fetal position. Then coming to the option D, what is this? Pleural tapping. Pleural tapping we can call it as a thoracosynthesis. Thoracosynthesis. Thoracosynthesis we can do in the sitting position. Sitting position. Pleural tapping we can do in the sitting position at the level of 8th intercostal space. Eighth intercostal space, we have to insert the needle to thoracentesis. And answer of this question is A. Then coming to the next question. What is this question? Core body temperature can be measured using all of the following method except. In this question, there is a keyword that is except. You have to observe for the these words like except, AC, expect also, expect, and expect, expect also. Okay, select all that, and then coming to the options: oral, rectal, tympanic, and urinary bladder. There are types in the temperature checking. Okay, core body temperature and surface body temperature. If you are checking the, if you want core body temperature, means you have to check the some areas are there, that is nasopharynx, nasopharynx and lower esophagus, lower esophagus and bladder and tympanic region, tympanic membrane. Okay, in rectum also you can check nasopharynx, lower esophagus, bladder, tympanic membrane, and rectum. We can check core body temperature. And which all are the surface body temperature sites? That one: oral, axial, and temporal. These are the reasons which we can check the surface body temperature, and these are core body and these are surface. Then coming to the option. Okay, what is this? They are asking core body temperature except. They asked except means according to options, oral is the right answer. So we can check the core body temperature in these areas, and oral will be the surface region. So answer of this question is A. Answer of this question is A. Okay, this is the last question. Thank you guys. This is the end of our second session, and I will come with the more questions, and suggest me which topics I can explain better, and what are the topics you are interested. Comment in the comment box. I will come with those topics. Okay, thank you, and join our Agni Nursing Academy app and download the app in the Play Store. Thank you.